Hello, and congratulations on your new position with Buffalo Toronto Public Media. My name is Amy Schroffstetter, and I'm the account executive with Walsh Duffield, Buffalo Toronto Public Media's insurance broker. Today, we will be reviewing the employee benefits available to you as a new employee. As a new hire, your benefits will become effective the first of the month following your hire date. Please be certain you are aware of your benefits effective date to ensure you do not have a lapse in coverage. This overview is also available in the provided digital benefits guide. This presentation will review your medical plan options. You do have a choice between two carriers, Independent Health and Univera. We will discuss spending accounts, both HSAs and FSAs. There are multiple non-medical benefits available to you as well. We will briefly discuss each. This presentation will conclude with instructions on how to make your enrollment elections through Employee Navigator, the online enrollment platform. Let's now begin with the medical plan overview, starting with Independent Health. The first independent health plan is the FlexFit Platinum Option 2. This is your traditional copay plan. There is no deductible, and the out-of-pocket max is the lowest of all the independent health plans at a $4,000 single or $8,000 family. All the medical services and hospital care have a set copay. This plan also has a very rich prescription drug card, $5 tier 1, $30 tier 2, and a $100 tier 3. If you are a high utilizer of your health insurance or have very expensive medications, this plan might be a good fit for you. The iDirect Gold Copay HSAQ plan is your first HSA qualified plan with the lowest deductible to meet HSA guidelines, 1,650 single or 3,300 true family. As a true family deductible, this means if you have more than one member on your plan, together you must meet the family deductible amount, 3,300, before moving to the cost sharing portion of the plan. Your medical services and hospital schedule are subject to the deductible, after which you'll see your cost share is a copayment. The prescription drugs are also subject to the deductible, and it's important to note that Tier 3 does have a 50% coinsurance. The iDirect Silver Copay HSAQ is structured kind of similarly to the Gold plan. However, you'll see your deductible is higher, and in general, the copays are higher. This plan also has a 50% coinsurance after deductible on Tier 3. The Bronze Coinsurance Plan has your highest deductible amount. However, this deductible is embedded, which means if you have more than one member on your plan, no one person can exceed the single deductible amount. Your medical services, hospitalization, and prescription drugs have a 50% coinsurance after the deductible is met. Remember, coinsurance is the percentage you owe of the contracted rate between the provider and independent health. This plan is also HSA qualified, and you'll see in the upcoming slides, Buffalo Toronto Public Media fully funds the single premium on this plan. It's also very important to remember on all independent health plans, preventive services, such as your annual well visit, immunization, routine mammograms, and colonoscopies when due, are covered at a $0 copay. Independent Health Local Network is the 8-county region of Western New York. You enjoy access to all hospitals, labs, and more than 98% of the Western New York providers. They also provide you with regional access in the central New York region and northern PA. Those counties are depicted in the dark red area. If you do see providers in these areas, it's always best to verify their participation with independent health before making your plan selection. In addition, Independent Health has partnered with United Healthcare for out of area access to providers. If you do seek elective care outside of Western New York, be sure to show the back of your IH card, which includes the United Healthcare PPO Options logo. You will receive the contracted rates between that provider and United Healthcare for that particular service. Remember, you are still subject to the out of area cost share on your plan, which is detailed on your benefit summary. Once you do enroll with Independent Health, you should register your secure account via the Independent Health website. Your account is the place to access your personalized health information, including claim usage, explanation of benefits, deductible trackers, and the ability to search providers via the Find a Doctor tool. For mobile-friendly access, we also encourage you to download the My IH app, which will contain the same information as your online account. Your ID card is conveniently stored in the app for easy access when visiting your providers and pharmacies on the go. Independent Health provides access to most of the pharmacies in the Western New York region. Please note, as of January 1st, 2025, CVS is no longer a participating pharmacy with Independent Health. There are over 300 preventive drugs for chronic conditions that are covered at no cost to you. These medications are maintenance type drugs used to treat common conditions such as high blood pressure, cholesterol, and depression. Independent Health will also allow you to fill a 90-day supply of your prescriptions via a retail pharmacy or through convenient mail order. Your provider will send the prescription electronically to either ProAct or Wegmans, who are Independent Health's mail order vendors. In addition, you receive a savings. Your cost is 2.5 copays versus 3 copays when filling a mail order prescription. Teladoc is Independent Health's telemedicine provider. Telemedicine allows you to seek care for acute conditions 24 hours a day, 365 days of the year. Download the Teladoc app and set up your account now. You will want to have this available to you before you actually need it. On the Platinum plan, Teladoc is a $0 copay. You are subject to your deductible on the other Independent Health plans. Once you meet your deductible, Teladoc visits are also a $0 copay. U.S. board certified physicians will treat non-urgent issues such as colds, flus, pink eye, and rashes. They will also treat dermatology and behavioral health. We are now going to discuss wellness resources available through Independent Health. Independent Health offers two options for the wellness benefit. You must select your benefit upon logging into your account for the first time. The Health Extras card is a $250 prepaid Visa, which you can use towards a variety of health and wellness goods and services. The card value is one per contract. Therefore, you will share this amount with your eligible members on the plan. The card is now accepted at most vitamin stores and fitness facilities. The second option is Nutrition Rewards. This benefit is tied to your TOPS bonus card. If you are a regular TOPS shopper, for every $2 you spend on fresh produce, you receive $1 back on your nutrition rewards card. The card is sent on a quarterly basis and can be used towards purchases within the store, anything except tobacco products. Independent Health's Red Shirt Rewards. Independent Health is paying you to be healthy. This provides you with a $10 Red Shirt reward for each eligible service that helps you manage your overall health. These services are generally preventive services, which are also no cost on your health plan. Each member on your plan, 18 years of age or older, is eligible to earn rewards up to $30 for the plan year. And here is how it works. You do have to activate the program through your online account. Once you complete an eligible action, it is automatically claim verified, and Independent Health sends you a $10 gift card redemption link to your email. The link will expire in 90 days, so the best advice is to click on it immediately and load it into your Amazon account. Other retailers that participate are Nike, Target, and so many more. Brook is Independent Health's digital companion app. You can chat with health experts such as dietitians and health coaches for best ways to build healthy habits. You can track your nutrition, your sleep, set reminders for your medications, and build exercise programs. Brook Plus is a year-long, fully digital, CDC-recognized diabetes prevention program that helps members reduce their risk of type 2 diabetes. If you qualify for the program, you will receive a scale, fitness tracker, and dedicated coach to help you achieve your goals and stay on track. This slide gives you the employee cost by pay period for each of the plans and their corresponding tiers. The company contributes a flat dollar amount to each tier. Based on those contributions, the employee-only bronze plan is fully paid by Buffalo Toronto Public Media. Your costs will increase as you move from the bronze metal level to the platinum. We will now discuss your second medical plan option, Univera Healthcare. Univera's Platinum 4 is your traditional copay plan. There is no deductible, and you have set copays on your medical services and hospital care. Unlike the Independent Health Platinum plan, this prescription drug card does have a 50% coinsurance on Tier 3. So it is recommended to verify your prescription coverage before making your plan selection. The Gold 5 is your first HSA qualified plan. After a $2,000 single, $4,000 true family deductible, your cost share is a set copay amount. The deductible is true family, which means if there are 2 or more members on the plan, you must meet the family deductible amount before you move to the cost-sharing portion of the plan. The prescription drug coverage has copays on all 3 tiers once the deductible is met. The Silver 5 has a higher deductible amount, set copays for medical and hospital care, and the prescription drug card is a 50% on Tier 3 after the deductible is met. The Bronze 3 plan is the highest deductible amount of all the plans offered at $6,100 single or $12,200 family. It is an embedded plan deductible, which means no one member on the plan can exceed the single deductible amount. After the deductible is met, this coinsurance is less than Independent Health's Bronze plan at 25%. It is also important to note Preventive services, your annual well visit, immunizations, routine mammograms, and colonoscopies when due are covered at $0 on all Univera plans. The Univera network is one of the largest local networks, covering 39 counties of upstate New York. 100% of the hospitals and 99% of the doctors do participate. In addition, they have contracted directly with providers in the 8 northern PA counties to assist with full access to care in the Southern Tier region. Once you are enrolled with Univera, it is recommended you set up your personal online account. Your account provides you with your plan information, deductible and claims spend, as well as how to find a doctor, pharmacy, or price a prescription. The Univera Healthcare mobile app allows you to access the same information on the go. You can access the FDA-approved list of prescriptions referenced in the path on this slide. The formulary will list every Univera covered medication and their corresponding tier. It's a good idea to work with your provider to prescribe a generic medication if available. Many of these are on the preventive drug list and covered in full. Mail order is available through Wegmans, home delivery, or Express Scripts. Your provider will electronically send a 90-day script to the mail order provider of your choice. Your cost will be 2.5 copays versus 3. Mail order tends to be an underutilized benefit and is a great option for maintenance medications used to treat chronic conditions. Univera's telemedicine vendor is MD Live. Similar to Teladoc with Independent Health, MD Live is available 365 days of the year, 24 hours a day. If your primary care physician is not available, it's a great option to treat non-urgent issues. Telemedicine can also be a good choice for your dependent children who are out of town or if you're traveling and in need of medical care. On the Platinum plan, telemedicine is a $0 copay. The 3 high deductible health plans, telemedicine will be covered in full once the deductible is met. MD Live also offers behavioral health services if in need of mental health counseling. We will now review the wellness resources available through Univera. WellFrame is Univera's digital health companion. You can download this app and receive immediate access to registered nurses, care managers, and dietitians who will provide you with confidential support to help manage your health each and every day. You will work with these professionals to develop a personalized care plan in a text chat based format. Vitalize is Univera's digital home base for health and well-being. In partnership with Personify Health, you can use Vitalize to help you build healthy habits. You can connect your fitness tracker, work on eating habits, sleep, and nutrition through the Food Smart app. In addition, Headspace is included with your Univera plan. Headspace is a mindfulness and meditation app to help you manage stress, focus, and sleep. Vitalize also offers you the ability to collect rewards when completing health activities. Setting up your account and completing the health assessment earns you a $25 reward. As you continue completing health activities, you move through the levels and earn points. As you reach milestones, your points convert to rewards cash and can be redeemed for gift cards and merchandise. Vori Health is virtual physical therapy for back, neck, and joint pain. Your virtual physical therapist will design a treatment plan for you. It begins with a consultation, diagnosis, development of your personalized plan, and support from the care team as you utilize related exercise videos available to you 24 hours a day via the web or mobile app. On the Platinum plan, Vori Health is covered in full. On the high deductible health plans, once the deductible is met, visits are also covered in full. WellVie My Surgery is a surgery decision support tool. If you are facing surgery, this tool will guide you through the decision-making process, providing you with additional questions to ask your doctor, different treatment options that may be available to you, and tips to prepare and recover after surgery is complete. If you set up your WellVie account and complete the first 3 steps, they will send you a $25 Amazon gift card. Perks for you are deals available to you as a Univera member. Check the list of participating vendors at the link in the slide. You'll save money with exclusive discounts at local health and wellness retailers throughout Western New York. This slide gives you the employee cost by pay period for each of the plans and their corresponding tiers. Overall, you'll see these premium amounts are slightly less than the independent health premiums. As communicated earlier, the company contributes a flat dollar amount to each tier. Based on those contributions, the employee-only Bronze plan is fully paid by Buffalo Toronto Public Media. Your costs will increase as you move from the Bronze medal level to Platinum. Let's now discuss spending accounts, both health savings accounts and flexible spending accounts. Health savings accounts are bank accounts owned by you that pair with a high deductible health plan. Your independent health and Univera Gold, Silver, and Bronze plans are all HSA qualified. Buffalo Toronto Public Media generously provides an annual employer contribution of $1,000 on any gold or silver plan. The employer contribution on the Bronze plan is $1,500. These funds are distributed generally twice a year, in February and August. However, as a new hire, the contribution will be prorated based on the number of months left in the plan year. HSAs have plenty of advantages. Your payroll contributions are made on a pre-tax basis. The money grows tax-free and is never taxed when withdrawn. The funds you set aside can help you reimburse qualified medical, dental, vision, and prescription expenses. HSA dollars remain with you forever, so they become an excellent retirement savings vehicle. Each year, the IRS will dictate the contribution limits for HSAs. In 2025, the single limit is $4,300. The family limit is $8,550. For those aged 55 or older, an additional $1,000 catch-up contribution is permitted. If you have your own HSA account established from another employer or your individual bank, you are welcome to provide that bank information to the People Operations Department. If you do not have an account, Buffalo Toronto Public Media will set you up with their HSA provider and National Bank Health Equity. The Medical Care Flexible Spending Account is administered through BRI. The Medical Care FSA allows you to use pre-tax dollars towards eligible medical, dental, and vision expenses. Your entire annual election will be available to you on the first day of the plan year. You can access your funds through the Beneversal prepaid MasterCard or pay out of pocket and submit a claim for reimbursement. The maximum medical FSA contribution for 2025 is $3,300. However, plan wisely. There is an allowed $660 rollover into the next plan year. However, anything above and beyond that amount will be forfeited. It is a use it or lose it benefit. Don't forget, many over the counter items are eligible as well. Allergy, cold, sinus, pain relief, first aid supplies, diabetic supplies, and many more. Dependent care accounts allow you to set aside pre-tax dollars for eligible expenses such as daycare, nursery school, after-school care, and summer camps. These expenses must be work-related to qualify for the credit. The expense must allow you and your spouse, if filing jointly, to work or look for work, and must be for a qualifying person's care. These are cash balance accounts. Your available balance is based on the amount deducted from your payroll minus the number of prior payments or claims that have been processed. You must submit a claim to BRI for reimbursement. Claims are processed on the date of service, not based on the date you paid out of pocket. Claims are not reimbursed until the service has been provided. The maximum dependent care contribution for 2025 is $5,000 per household or $2,500 married filing separate. Remember, always save receipts for documentation. BRI will verify most transactions, but if a transaction cannot be verified, a receipt will be required. We are now going to begin the non-medical plan review, starting with the Guardian plans. This includes dental, vision, basic life, voluntary life, and critical illness. There are 3 dental plan options available to you. Buffalo Toronto Public Media contributes a portion to your dental benefit. The remaining cost is detailed on the slide per pay period. The plan does provide in and out of network coverage, but remember, finding a participating provider will give you the most benefit. There is no plan deductible on all 3 options while in network. Your dependents can remain on the plan until age 26. Let's start with option 1, the value plan. Preventive care is 100% covered. When in network, basic procedures such as a filling or an extraction is 80% covered, but there is no coverage on major procedures. There is a $750 calendar max, meaning Guardian will reimburse up to that amount for all covered services within one plan year for each eligible member on the plan. Option 2 is the basic plan. Preventive care is 100% covered. When in network, basic procedures are 80% covered, major procedures are 50% covered. In addition, there's a $750 allowance on orthodontia, and the annual calendar max is $1,000. Option 3 is the enhanced plan. Preventive care is 100% covered. When in network, basic procedures are 90% covered. Major procedures are 50% covered. There is a $1,500 allowance on orthodontia, and the annual calendar max is $1,250. Guardian's Dental Network is a very robust one in New York State. It's easy to find an in-network dental provider. Go to guardianlife.com and click Find a Dentist. You can search providers by distance, specialty, and language spoken. There are four vision plan options available to you at a 100% employee paid benefit. There is a low-high option with each of these network providers, VSP and Davis. The low option benefits are the same for each network. The high option benefits are the same for each network. Therefore, you are making two decisions. Which network will I choose and how much benefit do I need? VSP is the largest network of independent providers. Davis Vision contains the big box retailers like VisionWorks, Target Optical, and Walmart. Let's review the low plan first. The low plan has a $10 exam copay. Lenses are a $25 copay and frames are a $120 allowance after your material copay of $25. Contact lenses are also a $120 allowance and frequency for the exam is once per year. For the lenses and contacts, it's once every 2 years, and for frames, it's once every 2 years. Let's now review the high plan. The high plan also has a $10 exam copay. Lenses are $25 copay, and frames are a $130 allowance after your material copay of $25. Contact lenses are also a $130 allowance, and the frequency for your eye exam is once per year. For lenses and contacts, once per year, and for frames, once every 2 years. Your dependents can remain on the plan until age 26. To choose your vision provider, go to guardianlife.com and select your vision network. You'll see links to the VSP as well as the Davis Vision search tool. Buffalo Toronto Public Media generously provides employer paid life insurance for all eligible full-time employees indicated as Class 5 on this slide. The benefit amount is 2 times the annual salary up to a maximum of $360,000. Upon new hire, you have a guaranteed issue of $360,000, meaning no evidence of insurability will be required. The benefit does reduce by 67% at age 70. Please be sure you name a beneficiary during the online enrollment process. Should you choose to elect additional life insurance for yourself, your spouse, or children, Buffalo Toronto Public Media does offer a voluntary life policy. The employee benefit amount is in increments of $25,000 up to $100,000. Upon new hire, your guaranteed issue is $100,000. Your spouse is eligible for $25,000 or $50,000 with a guaranteed issue of $25,000. Your children are eligible for $5,000 or $10,000 with a guaranteed issue of $10,000. Remember, evidence of insurability is not required up to the guaranteed issue amount if electing this benefit when first eligible upon new hire. Your rates will depend on your benefit amount and age. The critical illness policy will pay a lump sum benefit in the event of a newly diagnosed condition and a second occurrence of that same condition. Employees will choose their benefit amount, either $2,500, $5,000, or $10,000. Your spouse is eligible for up to 50% of your benefit to a maximum of $5,000. Your children are eligible for 50% of your benefit to a maximum of $5,000. Some examples of covered conditions are listed on this slide, but your benefit summary will have additional detail. Remember, there is guarantee issue when selecting this benefit when first eligible upon new hire. This means no evidence of insurability will be required. This is a 100% paid benefit by you, the employee, and rates will depend on benefit amount and age. In addition, this plan pays a $50 wellness benefit for completing certain routine wellness screenings or procedures, such as a mammogram, colonoscopy, and an annual GYN exam. Your dependents can remain on this plan to age 26. There are three more non-medical plans available to you offered through Mutual of Omaha. That is the short-term disability, long-term disability, and accident plan. Buffalo Toronto Public Media provides you with an employer-paid short-term disability policy. At time of this recording, the New York State statutory disability policy is required to send you $170 a week when out of work for injury or illness. This policy provides you with additional paycheck protection with a benefit amount of 66 and 2/3% of your pre-disability earnings up to a weekly maximum of $2,000. There is a 7-day wait period, and the benefit duration is 25 weeks. This is a taxable benefit. In addition, Buffalo Toronto Public Media also provides you with an employer-paid long-term disability policy. This policy will provide you with additional paycheck protection in the event you are out of work for injury or illness for an extended amount of time. The benefit amount is 66 and 2/3% of your pre-disability earnings up to a monthly maximum of $8,500. There is a 180-day wait period and the benefit duration is to Social Security normal retirement age. This is a taxable benefit. The accident protection policy will pay a lump sum benefit in the event of an accident on or off the job. There are two plan options, a low plan and a high plan. For accidental death, the employee benefit amount is $25,000, the spouse is $10,000, and the child is $5,000 on the low plan. The high plan pays larger benefit amounts, $70,000 for the employee, $35,000 for the spouse, or $10,000 for the child. A sample of covered services is listed on this slide. You'll see the high plan will pay a larger lump sum. This is 100% paid by the employee and rates are noted on the slide per 26-week pay periods. And finally, Legal and ID Shield memberships. Legal Shield provides you with direct access to a dedicated law firm for legal advice and consultation on unlimited personal issues. They can assist with will preparation, speeding ticket assistance, and contract review. ID Shield provides you with fraud detection, monitoring services, credit and social media monitoring, and consultation on cybersecurity questions. The memberships can be purchased on an individual or family basis and the monthly rates are included on the slide. How should you make your elections? Buffalo Toronto Public Media's online enrollment platform is Employee Navigator. You will be receiving a link in the new hire email from Employee Navigator. This link will expire in 14 days. Once registered, your employee dashboard, shown on the slide, will highlight and direct you to your onboarding items. As you navigate through the enrollment flow, you will be asked to verify your personal and dependent information, select or decline benefits, review and confirm your elections, and submit any evidence of insurability to Guardian only if you're electing over the guaranteed issue amount. That concludes our new hire benefits overview. Should you have any questions about the information in this presentation, you can direct them to Jen Hasse, Director of People Operations, or any member of the People Operations team. Thank you.